I would say that I think one of the things that I'm bringing to Google is my experience at FDA. And Google as a big platform, which reaches so many people across the world. Billions of people do searches on Google search today across the world. Every day we get, multi-billion searches happening. And big part of those search are actually health-related search. So when I heard that story, when I heard the story that Google is also very interested in making sure that health reaches billions of people, our goal has been to make billions' lives healthier. And that mission really resonated with me. And for me to come in there and help them guide through their regulatory strategy. How do you deal with the governments across the world? How do I think about shaping risks and benefits for technologies that may actually be helpful for many people? So that's kind of the goal I went in with. Now Google does many things. They don't have like a one company, one product kind of thing. They do search for YouTube. So helping them see where there's big benefits, how guiding them through where they should lean in and where they should continue to do what they're doing. For example, on Fitbit, they're looking at ECG on all Fitbit sort of devices. Now, if you think about like how can Fitbit change the world, I think getting ECG on a Fitbit or wearable, it is going to make ECG available for everybody on without actually going to a doctor's office. So those are the kind of changes that will happen. Diabetic retinopathy screening tools. We have lots of AI research going on at Google, and how can I help Google take those AI research to do pilot projects in places like we are doing in Tamil Nadu today, and also looking at how do we actually do things in a very how should I say, like a very legally compliant way, and that's kind of the help I want to give, and that's the strategy I'm trying to build. It starts from information. Google's known to have the best information, being able to present information that's on the web very logically to people. So search, YouTube, maps. We also have cloud services that can take on those services. Then you have the wearables. Not only the wearables that you hear about Fitbit and stuff, but also phone. So how can we take world's information and present it in a really easy way for people, and then focusing that on health is like one stream of discussion. The other thing is like we have lots of research in AI and lots of like activities going on in AI. In fact, we are trying to enable people, and you heard me talk about it today, like can we create platforms that others can build upon, so make it more generally available. One recent example I'll give you is we just published a open source model for AI that that is pre-trained, so people can use that model and train it with less number of data sets, because with AI you need more data to create the model better, right? So what we have done is we have trained it to a certain level that reduces the number of data sets needed for training for example, detecting TB or some other on-chest x-rays. So we did that recently, and those are the kind of things that Google is really focused on, is how do we enable rather than creating ourselves, right? I mean, we'll create our things, but we also first think about like how do we make things that will just make it so ubiquitous that everybody will start using it, start building on it. Diabetic retinopathy is definitely one of the areas we are focusing on. Mammography, automating mammography screenings is another area we are specifically focusing on, where basically taking images that are captured through mammography clinics and other places and using AI to detect that and change, like spot it quickly before a doctor sees it, right? So that's kind of how we are thinking about it. Is like when we supplement doctors' readings with AI that can actually be helpful, can detect quicker and earlier. So those are the things. So we are having less misses and other things. The mammography and the diabetic retinopathy, there are some pilot projects that are going on. There are some of it is with governments who are trying to screen people or reach people. And there's going to be some options where we would probably partner with like a mammography machine maker and say use this AI model on top of your mammography machine to sort of get to a place where they can detect quicker and more reliably, consistently. One, can it be easier for developers to develop tools, apps, or some solutions, right? So and can it be interoperable? So data has to go from one system to another system easily. So one of the things that I shared earlier was we are creating an open platform that's based on FHIR, which is a data exchange format that is used in for healthcare, and creating like software development toolkits that developers can sort of take it and use it to build apps easier, and so they can connect it to providers easier. So that's one way to think about it. And the pilot projects that I talked about for diabetic retinopathy is actually the project itself is to reach people so they can screen people who are not normally who in our current system takes a very long time to get screened. So being able to quickly take pictures and screen them to saying, okay, we need to, out of this 100, this 20 needs to be seen tomorrow because they are in the verge of getting diabetic retinopathy, and then the others are not, or can be waited. So it helps the healthcare system to help to focus on focus on people that are on most urgent need. The research on diabetes retinopathy has been going on for a very long time. That's number one. And I think at that time, and I don't know the entire history, but at that time, diabetes to be spotted, and diabetic retinopathy can actually lead to really bad outcomes for losing eyesight, right, down the road. So that was the reason why there was lots of energy around that. And it's also an extension for imaging, right? So if you take a fundus picture, or your retina picture, your fundus camera, it's another application for how we can transform what was done in other image recognition or image analysis to diabetes. And then the question was like, how can we really spot other things? There are many other things that can be spotted, but I think this was the easiest, like, first step to sort of do this. There's this fundamental thing with cloud that's happening where people used to store images locally in their facility, and now cloud sort of enables to do things at a scale that you don't have to store it in their phone facility. So it's called on-premise storing versus off-premise storing, right? So cloud offers their off-premise storing. Cloud also offers off-premise computing, which means that you don't have to like have big computing or systems on your premises. So now you couple that with our capabilities to do image analysis and or search. So that now gives the power that sort of is centralized and can be like scaled based on like your needs, is really what the cloud sort of systems is going to provide the imaging industry, which means there's going to be less issues that result from scaling. Like, for example, if your practice is like, say, 100 clinicians, I'm just making this up, but now like over time it's going to go to 10,000 or 100,000. You're going to have to worry about what infrastructure do you need, how much storage, how much computing power do you need, and then using cloud solutions actually it helps you sort of scale that part, right? So that's how I see it scaling. To be seen. This is very hypothetical, right? I think very new, like you said. But people are going to experiment with this virtual reality and augmented reality. I've already seen other augmented reality where um, doctors are using augmented reality combined with their X-rays and or like imaging scans, to sort of see how to do surgery. So those are things that are happening today, but they're not very precise as you can imagine, right? I think the avatars and other things that's sort of proposed in metaverse, that's an interesting concept. It's really good in gaming, but we haven't quite figured out what it should be in medical, right? I can see there's lots of other research happening where humans, as in general, we are really good at like reacting to something if we get burned, for example, or we get hurt. But somebody says to you like, oh, you're going to get hurt like 5 days down the road, or like if you do that like 10 years down the road, we don't pay attention to that, right? So when you start thinking about education and health education, health literacy, if we can start making people realize what the outcomes are, so we can take actions on them. Diabetes is a great example. Cardiac failure is another example. Just aging in general, like if you don't do certain things, you are going to age differently versus this. So I see those kind of things sort of emerging, but I'm not quite sure whether we will be there. I know there are some other applications who have been like trying to change behavior by scan. You probably see this on Facebook and other places where you can slide a slider and sort of see how would you look if you look we are old 60 years from now, or how would you look when you're young. So all those things are like fun right now, but I think they could be used for educations. It could be used for motivating people to sort of make sure that they are doing what they're supposed to do, taking care of themselves. To be seen, because I'm still trying to figure out all the stuff that's happening at Google, but I would hope that we are able to make an impression and in the world. And going back to my original, like my intention for joining Google was to be supportive and enabling. And how can I enable to the best possible thing that that healthcare needs, right? And I would say, if I were to wish, and this may not happen at Google, but if I were to wish, I would love to sort of have Google spend time in places where a lot of conditions that goes undiagnosed in normal life, and can we sort of move that, and can we create solutions that will help towards that, as kind of what I would hope personally, and I know hopefully I'll play a small role in that.